We're talking about lifestyle issues here. These are, for example, people smoking, people's levels of physical activity and levels of obesity, people with alcohol problems and drug addiction problems, and also mental health. By and large, we group those things together and we call them lifestyle issues. They're very traditional, they've been around for a long time, and what we have is currently very accessible services.
The NHS Health Check is a pilot scheme which we've been running in Hamworthy and is due to be rolled out nationally in the near future. The idea behind it is to identify those patients who are at increased risk of developing heart disease, strokes, diabetes and kidney disease. Well patients who are over the age of 40 are invited to the surgery to have a health check. After the health check, all patients are given information about how they can change their lives to live longer, healthier lives. This is particularly relevant for those patients who we find have high risk of developing heart disease, strokes, diabetes and kidney disease. We have identified some patients who have high blood pressure, have high cholesterol and have developed diabetes, and those patients didn't know this when they came for the check. Some patients require medication and follow-up, but the vast majority can make simple lifestyle changes and live healthier lives. I have a patient who has undergone a health check and has made significant changes to his lifestyle.
Me and my wife, we came to this doctor's surgery a couple of months ago. General check, and I was quite surprised to realise my blood pressure was high, my cholesterol was high, and I was overweight. The doctor suggested I had a 40% possible chance of having a stroke or heart attack if I didn't change my ways, i.e. exercise, diet, pretty well everything. So after a month or so, I came back to the doctors, checked my heart, my cholesterol, my blood pressure, and I was pleased to realise that my blood pressure had gone down, my cholesterol had gone down, and that was just with a change of lifestyle, i.e. exercise, diet, and that was it. And I was pleased as punch because obviously I felt a lot better in myself, and hopefully it'll give me a couple more years extra life.
But the issues we're now facing is that those services can reach a certain number of people. And what we now know is that, for example, with regard to smoking, we've still got about 40,000 people who smoke despite the success we've had. We've got an increasing number of people who are overweight and obese. We estimate that's about 60,000 adults. So that's a very large number of people to try and reach. With those sorts of numbers, the sort of services we've been offering up until now will only reach a small proportion. So we need to find other strategies. As we do that, we need to recognise that that size of population, in terms of people who need to change, will have their life expectancy reduced. The average age at which people die of an addiction in this area is 33. The average number of years saved if people stop smoking, they can add another 10 years to their life. With mental health, it's slightly different, because by and large, mental health problems don't kill people, but they significantly disable them throughout their life. So they have issues which might affect 10, 15, 20 years of their life, as they have anxiety problems, episodes of depression. So we've got one set of lifestyle issues which is shortening people's lives, and another set which is disabling them for many years of their life. We've got accessible services, but the next stage is to work with people themselves. Actually, unless we reach people and ask themselves what they can do, ask people what they can do, we're going to continue to reach only a very small number, because we want people to change, and they've got to feel change is worthwhile. So it's not so much us doing things to people, but it's about asking people themselves about how they can change. We're filming here in Poole Park. The weather is fantastic, and that's about environment. In this area of Bournemouth and Poole, we have a fantastic natural climate. So our opportunities for doing things, particularly outside, is much greater than elsewhere. So in summary, we've got three key messages. The first is that we've been relatively successful in setting up accessible services that people find easy to get to. But that only reaches a proportion of people, and what we now need to reach is a very large number of people. In order to do that, we need to involve them because people are very different. We need to find messages that people will respond to and involve them in doing that, as I've said, because a lot of that is social and people need to feel as though they're getting something out of it. The third message is, with the sort of population that we're dealing with, we need changes in the environment, changes in transport, changes in planning our towns and cities to make them walkable. People feel as though they can walk, cycle, get to work through active travel. The overriding message that crosses all of these areas is how we communicate, how we differentiate and make our messages a bit more sophisticated for the different sorts of people that we want to talk to.